Uncompensated care is on the rise in Wisconsin. From hospitals alone, we're looking at $1.2 billion in the year 2018. That's up over 7.5% over 2017 numbers, of increase of $87 million. And this is a combination of both bad debt and charity care provided by Wisconsin hospitals in the fiscal year 2018. This comes to us from the Wisconsin Hospital Association's report that documents these numbers. Nationally, the number is over 38 billion. We put a chart right to the side here that you can see that shows we are moving in the wrong direction after substantial gains were made after the Affordable Care Act was passed. And in Wisconsin, we tried to have an emphasis on getting more people connected to programs like Badger Care Plus. But we're swinging the wrong way after a long time of some sabotage to the Affordable Care Act, after some junk plans, what are short-term plans were introduced as appropriate insurance in many states, including Wisconsin. We have a lot of disruption in our insurance marketplace. We also know from the Census Bureau data that more families are uninsured in Wisconsin, and that includes more children. Wisconsin is swinging the wrong way with the number of children that are being dropped off of Badger Care Plus and Medicaid programs. And like we said, there's market instability. There are bigger healthcare costs, which could be also out-of-pocket costs, high deductibles for consumers. But we know there are other things that contribute to the rate of uninsurance and therefore uncompensated care, such as the bureaucracy and red tape, the ever-changing program rules that come in programs like Medicaid and Badger Care Plus, surprise medical bills, which put people into medical debt, and that gets reported very frequently as bad debt to the hospital if they can't be paid. And of course, the political chatter that happens around things like Obamacare, the Affordable Care Act, and Medicaid expansion. Now, we know that when people are uninsured and they can't pay their medical bills, that cost gets shifted to everybody else. Other people's health insurance premiums and the cost of their care goes up when uncompensated care goes up. We know that people are actually, in fact, eligible for a lot of programs but not enrolled, and there are a lot of steps we can do to try to be a little bit more proactive, try to find those individuals, use some good consumer assistance strategies to connect them to the appropriate healthcare coverage and start chipping away at some of those costs. We need to think longer term for solutions instead of shorter term. We link to that Wisconsin Hospital Association report in the description below. We also show where we got that data of that national number for uncompensated care, that 38 billion number that is also moving in the wrong direction. Go ahead and like this video and subscribe to stay up to date on uncompensated care, medical debt, charity care, and other healthcare coverage programs.